Nick Majerison here. Welcome to Top Med Talk. Today it's a conference highlight taken from our coverage of Anaesthesia 2018, the international meeting of the Royal College of Anaesthetists. NAP6 is the largest ever prospective study of anaphylaxis related to anaesthesia and surgery. This podcast is one of the standout pieces of our coverage of the Royal College of Anaesthetists annual conference in London. Joff Lacey presents with his guest, Professor Tim Cook, consultant in anaesthesia and ICM at the Royal United Hospitals in Bath. The question he's asking is, when's the best time to administer antibiotics? Have a listen.
Top Med Talk.
Tim, you advocated the best time to give the antibiotics is when the patient's awake. Anecdotally, some people will say that the best time to give an antibiotic if there's a risk of anaphylaxis is actually when they're anaesthetised, intubated, you've got no airway concerns that may develop as part of the anaphylaxis. I'm interested to know, kind of combining some of your NAPs here, but were there any airway issues in the cases that you examined for NAP6?
The simple answer is that there were almost none.
Really?
So of the 266 cases we looked at in detail, there was one case of front of neck airway. We weren't clear whether that was due to anaphylaxis or other reasons. There were precious few cases where patients even needed to have their airway changed to be intubated, and there were no difficulties.
Really?
So what seems to be the case, which is actually previously known, is that the more severe your anaphylaxis, the less likely you are to get rash, generalised swelling, and indeed laryngeal edema or airway swelling. So in the severe
primarily
cases,
the blood pressure, the
correct,
hypotension.
Correct. So bronchospasm and hypotension are the predominant features, or cardiac arrest. And so we simply didn't see that as a problem, and therefore the idea that you must secure the airway before giving your antibiotics to protect the patient can be debunked. I would say there are three benefits to giving your antibiotics early. The first is that with the awake patient, you can confirm that they're not allergic to the drug they're about to give. That's a common mistake that anaesthetists do make, and others, of course, do make. The second is that if you do have anaphylaxis, you should detect it before induction of anaesthesia, and it won't be confused by post-induction hypotension and can be treated probably more easily. And a third and important issue is that the investigation is made considerably more complicated. So investigation of perioperative anaphylaxis is quite complicated because on average we're giving 8 drugs for every anaesthetic, but up to 20. And disentangling what drug has caused those problems can be very difficult. And so if we've only given 1 drug or 2 drugs, and we send the patient to the allergy clinic, their job is a lot easier, and that's in the patient's interests. So one of our key recommendations is that antibiotics are given as early as possible and ideally to the awake patient.
Top Med Talk.
This short clip is taken from a longer conversation which you can find under the title RCoA 8, NAP6, Perioperative Anaphylaxis. We think it's one of the standout pieces from our coverage of Anaesthesia 2018, the international meeting of the Royal College of Anaesthetists. Do remember you can meet the Top Med Talk team when we're going to be at the results of the Extreme Everest Symposium, June the 14th, live from Duke University in America. And of course, we're at all of the EBPOM meetings. Check out ebpom.org and find out how you can meet the Top Med Talk team.